everyone, this is Jennifer with I Want You Colorado Springs, bringing you video interviews of local professionals and business people. So I'm so excited to be here because you are one of my favorite people in the whole city.
Thank you, Jennifer. You're one of mine.
So tell us who you are and what you do.
I'm Dr. Jenna Bridgewater, and I am the co-owner of CJ Chiropractic. I own this practice with my husband, and I specialize or focus my attention on pediatrics and pregnancy care and helping women with their health. And then my husband focuses on the rest of the family.
Nice.
Yeah.
So what made you decide to go into chiropractic care?
Originally, I wanted to be a cardiologist. So
that's a big jump.
Right.
Well, I mean, it's still a medical profession. But...
Yeah. So I liked the idea of cardiology, one, because I do like blood. It's just me. But I like the idea of prevention, so helping people to get well and stay well. Well, I had an internship my senior year of high school with a cardiologist who was amazing and got me into all of these different areas of cardiology so I could experience everything, and I thought it was just the greatest thing ever. Then he sat me down one day and said, I want you to really think about what you want to do with your life. It seems like what you want to do is the prevention, helping people to be healthy. I want you to know that I don't get to practice the way that I want to. My hands are tied by insurance companies, government mandates. Everybody comes to me looking for a magical pill to take away everything, and I don't have that for them. So the best advice I can give people is to eat a healthy, balanced diet and exercise. My patients who follow that advice get better. My patients who don't never get better. I end up seeing them in the operating room.
Right.
So I was like, okay, well, thank you, awesome, I'm still gonna do this. Got to my senior year of undergrad. Had a decision to make. Do I go to med school? Do I do something else? Mm-hmm. And I met somebody representing a chiropractic college, something I had never considered. I had friends who'd been adjusted. I had never been adjusted. I was like, well, I'll listen, whatever this is. And then I did a complete 180 in my mind and said, no, I think this is what I'm meant to do. Talked to a friend who was in chiropractic school, convinced me to go to Palmer, and what I saw was the potential for what chiropractic could do to help people get well and stay well. Right. So that's exactly what I wanted to do in life. And got my first adjustment while I was in chiropractic school. It's a little unusual. Most people, they've had that life-altering adjustment, and that's what made them want to be a chiropractor. It ended up changing my life. It was amazing, but it wasn't what led me here. It was, that potential, and I was really excited about that.
I think that's something a lot of people don't realize with doctors is that they think, doctors are just in it for the money, and honestly, doctors don't really make that much money. No. I mean, you can, but it's not usually their driving force. Right. And that they are really honed in by the insurance companies and all that kind of stuff. So it's all this red tape.
It is, absolutely. I like to say we don't necessarily have a healthcare problem, we have an insurance problem here in America.
Yeah.
So.
And that's a whole nother
story. It is, totally.
Yeah, thankfully I'm healthy in many respects, and so I don't usually ever have to go to the doctor, which is great. And that's one of the things that I know you just touched on a little bit, though, is having chiropractic care for preventative reasons.
Exactly.
So, can you explain what that means?
So it's helping you to be in your best shape possible. So that way the illness and the injury either never come, or if they do, you're fully capable of handling it and recovering from it naturally. So we advocate for kids getting into our office as early as possible, because if we can prevent them from ever needing those back pain medications or the surgeries later on, going through a lot of the attention issues that kids deal with now, if we can prevent that from ever happening, it's amazing.
Now, you do stuff on babies too.
I do. Yeah.
Because a lot of people don't even think about the birthing process being
it's very
so traumatic. Yeah.
Yes.
So when you think of so this kind of segues into the other part. When you think about chiropractic care, you're always thinking of the
oh yeah.
And all that stuff. And so, growing up when I got chiropractic care, that's what I had, right? So my chiropractor always did that, and you know, I remember one time I couldn't turn my neck like more than that, and you know, for I don't know, like 5 days, my mom's like, you know what, we're taking you to the chiropractor. So we went.
Good for your mom.
Yeah, so we went and he did it, and I was petrified that he was going to kill me, that he was going to break my neck.
Yeah.
Right?
It's a reasonable fear.
Right. So obviously there's still some chiropractors who do that type of method, but you do something completely different.
Absolutely.
And so and I meant for you to bring in one of your things, but I completely forgot. But
that's okay.
they can find you for more information.
Exactly.
Right? So can you explain though the device that you use?
Well, we use what's called an activator. So it's the leading edge in chiropractic right now. It's got a ton of research behind it, and it's also the technique and the instrument that's used in chiropractic research now, which is amazing. So that being said, it's an evidence-based technique, and I use an instrument to adjust instead of using my hands.
Right.
It's possible for me to use my hands. I'm very well trained in that as well, but I prefer the activator because it's incredibly gentle. I keep you in a neutral position, laying face down on a table. You don't have to worry about your neck being twisted the wrong way because I'm not going to do that.
Right.
It's incredibly effective. The research has shown that. With the activator, we can move the bone just as much as a manual adjustment, but we don't have to use as much force to do it.
Right.
And then it's incredibly safe. So I know the big fear out there is stroke in chiropractic. And it happens like 1 in a million. I think that's what has been shown for the statistics there. But it's still a fear, you know. Who is that 1 in a million?
Right.
Thankfully, with Activator, we have yet to have any of those cases attributed to an Activator chiropractic adjustment. So with that being said, I can use the Activator on a baby. I do. I have a 22-month-old that I see that I've been adjusting with an Activator for several months now. I can use it on you or me. I can use it on my husband, who's a big burly guy, and I can use it on my great grandma. And it's going to be just as safe for anybody.
Because it has different, you can adjust it, you know, based on.
It has 4 different force settings. Right. And so we've got regulations for, or I guess guidelines for which settings you should use in which area of the spine. So you're going to use a heavier setting, so more force in the lower part because it can handle more than your neck can. But it's also up to the practitioner, understanding the patient, knowing what their body can and can't handle.
Right.
So I'm not going to use more than a first level force setting on that activator on a baby.
Right.
Or my great grandma.
Right.
But again, on my husband, I'm going to use that 4 force setting up through his lower thoracic spine.
Right.
Yeah.
Now, one of the things that, because I've come to you for a treatment and I've really enjoyed it and I felt the difference and stuff, and one of the things that I didn't really realize is my feet getting out of place.
Yeah.
And I think a lot of people don't even really think about their feet being an issue at all. Like you walk around and like maybe your heel hurts and you're like, oh, maybe I've got heel spurs or, you know, plantar fasciitis, or which you might, you know, who's to say you
it's
don't.
possible.
But it might not be that. It could be that the bones are just misaligned.
Yeah. And a lot of times we find that is actually the issue. So you'll go to your medical doctor to say, hey, what's going on with this? It's bothering me. It's not going away. Right. So they take x-rays and they look at them and they say, nope, nothing's wrong with you. Right. And you're like, I'm still in pain. What do I do?
Because your feet can affect your knees, your back, everything.
I mean, we walk around on a planet with gravity. Our foundation starts at our feet. If those aren't in the proper alignment, it's going to throw you off all the way up to your head.
Right. Yeah. And one of the other things that I know I haven't had an issue with, but I've talked to you about before, is carpal tunnel. That a lot of people, you know, have such severe issues with carpal tunnel, and what you do can help alleviate that, even with people who have had surgery try to correct that, and it's still not corrected. Right. Because it's more of a nerve, like a releasing thing, right? Right.
So a lot of times people will go in for that carpal tunnel release surgery, and most of the time they end up going back for 2nd, 3rd, 4th, 5th surgeries. Right. And you really want to be under the knife, under anesthesia that many times. Right. It's not good for you.
The money. I mean,
exactly. It's
just talked about the insurance.
It's expensive. Yeah. So would you rather pay, you know, thousands and thousands of dollars for a surgery, or, you know, a few hundred for a few adjustments? Right. So a lot of times it's the bones are misaligned in your wrist, causing compression on that carpal tunnel, and then you get the numbness, the tingling, the pain. It can even come from your elbow, your shoulder, or your neck.
Right.
So you've got nerves that come from your neck that go all the way down to your fingers. And so the issue can be anywhere along that pathway.
Right. I mean, it's crazy. One of the things that you do in your appointments, which I thought was so interesting, is the muscle testing.
Yeah.
And so can you do like a quick demonstration on something?
Yeah, totally.
So
a general muscle test, and what most people know around here to be muscle testing, is you bring your arm out, and I'm going to just say, resist my pressure here, and they check to see if it's strong. And then they'll use that to evaluate different areas. If the room we're in is Leslie Spelunker room, so she uses this for her therapy.
Right.
But what we do, we're trained and certified applied kinesiologists. So what I would have you do, instead of just that general muscle test, bring your arm out like this. And I'm going to push from here. Hold. So that tests your deltoid. Now bring your arm like this. I'm going to pull down. You pull up towards you. Now push out towards me here. So I just tested your bicep and your tricep.
Okay.
We know that there are specific nerves that go to these muscles. So that's why we want to be specific when we're testing those muscles. Because if there is something wrong, like let's say I tested your bicep and you weren't able to resist that pressure, you just went like that, there's something affecting that nerve pathway, and I gotta figure out what it is. I know. Maybe put your fingers together like this, and I'm gonna pull apart, hold together. Okay, that's sort of strong. Let's check and see, and hold. So your lunate's out.
Which I have no idea what that means.
So that tests your epauleumbilicus muscle, which can be affected by your carpal tunnel region.
Okay.
And that lunate bone in your wrist slides forward, compresses on that region, and that's it.
Out of whack.
Yeah.
So let me just kind of give my personal history of this. So the first time I went in, I was sitting on the table, or I don't know. I think originally when you're doing your initial consultation, I'm sitting, I'm not laying. And so, they're having me do all these things, and like you are trying legitimately as hard as you can to keep whatever it is up. And if something is out of place, you just can't do it.
Yep.
There's just no way.
Exactly.
And then you also have like this special chart in your room that can deal with emotions and stuff.
Yes.
And so it's the same type of thing. So if I was feeling frustrated about something, one of the things that you do is you try to pinpoint that frustration and what's causing it. And so doing that muscle testing and stuff. And then you do a special thing where you do a release. So Chris had me do it, and I felt like a weirdo. Can you show me what I can't even remember how was it like doing something.
What did
weird?
You do? Oh, probably. So when we do the neuroemotional technique, we find what emotion it is that's bothering you. We use the muscle testing to figure that out. And then we go along pulse points on either side. We know that those are connected with specific meridians within you. Okay. The one that changes the previous muscle test is the one that we want to go with for you to hold. And so we narrow it down to the most specific emotion or event that is triggering what's going on with you. Okay. We can tell because you get flushed. Some people cry. Right. We can tell when it's really invoking that emotion. Right. And so then we'll have you hold whichever pulse point that is. And so you can just hold one of them for now, and then put your hand over your forehead. That's your, those are your emotional points on your head. Right. And with that, it'll help your body. You just think about what it is that's triggering you. You breathe deeply with it. And then eventually your body releases it. And so our end game here is to improve your physical functioning by releasing whatever mental or emotional stressors are causing those issues for you. Because emotional stress can always cause your body to tense up, and then you get out of whack. And I mean, it's just this, cascade effect in a sense. Yeah. It's just, there's so much that you guys do here. It's amazing, the benefits of, coming to your office. And I honestly haven't been to any other chiropractor here, so I can't really say anything. And I haven't interviewed any others. So, I'm down, of course, if you're a chiropractor and want to get interviewed, to hear about how you do things. But, I love it here, and I recommend you guys all the time. So can you tell our audience, where you're located? Yeah, so we are just off of Academy in Lehman or Lehman, however you pronounce it.
I say different every time.
Yeah, I know. We're in the Hollow Brook neighborhood, so we've got a lot of dental and medical offices back here. We are the last set of buildings on your right when you're driving down Hollow Brook. We look really out of place. We look like we're from the Southwest region. But it's awesome. It makes us stand out. And we are the first office within those Hollow Brook office condos. So 2155 Hollow Brook Drive, Suite 70.
And then what's your phone number if they want to schedule?
719-445-0806.
And do you have a website?
We do. www.cjchiropractic.com.
So finally, the last question I have for you is how, as a community, can we help you?
Bring me your babies. Anyone who's dealing with any sort of pain. I know we like to focus on the prevention aspect, but we're here to help you get out of pain as well. So, you've had this aching back that's been bothering you for a long time, or you know somebody who does, your mom complains about all the time.
Right.
Give them our information, send them our way. We'll see if we're the right fit. At the very least, you get into our office, you get that initial examination done. If we think that we can't help you, but someone else can, we'll make sure we refer you to the right person.
Awesome.
Yeah.
So it's not like you're out for just the money.
Absolutely not. Actually, when we we also do a business outreach where we go into businesses and we provide lunch and learns. So we'll bring businesses lunch for free. It's no cost to them. And then we give a pretty cool presentation called How to Stay Young. And whenever we sign people up for initial examinations at those events, we donate 100% of our proceeds from those events to a charity we're working with.
Wow, that's awesome.
Yeah.
Well, thank you so much for being interviewed today.
Thanks, Jennifer.
Yeah. So as always, I Want You Colorado Springs is sponsored by glassblasted.com, where you can get all your custom and personalized engraved needs.
And they're awesome.
So make sure to check that out. So thanks everyone and have a great day.